Recently, cardiologist Dr. Eric Johnson performed the first cryoballoon procedure in the Memphis area. The new procedure is used to treat patients with atrial fibrillation, one of the most common heart disorders in the U.S. Dr. Johnson of the Stern Cardiovascular Foundation joins us to explain. Doctor, welcome to Smart Medicine's Heart of the Matter.
Thanks, Joe.
First, what is atrial fibrillation and how does it affect people?
Atrial fibrillation is a very common problem. It's an irregular heart rhythm coming from the top part of the heart. It makes the bottom part of the heart beat irregular, erratic, and often rapid. Therefore, it makes the heart beat less efficiently. Some people experience palpitations. They feel their heart pound and race. Other people may feel fatigue, short of breath, decreased exercise tolerance. They may feel lightheaded or dizzy. Sometimes it causes some vague chest discomfort. However, some people don't have any symptoms at all, and it's just picked up on routine physical examination.
How do you treat atrial fibrillation, and what are the options?
Well, traditionally, atrial fibrillation has been treated with medicines. In the past, the most important things are to make sure the heart rate's controlled and people are on blood thinner to prevent the risk of stroke. After that, we put people on heart rhythm medicine to try to maintain normal rhythm. However, none of these heart medicines are 100% effective and all have potential side effects.
What is the cryoballoon procedure?
Well, an alternative approach to medical therapy for atrial fibrillation is a catheter ablation procedure. It's like a heart catheterization we do for when somebody has a heart attack, only this deals with the electrical system of the heart. So we go up with catheters inside the heart and identify the place that's causing the atrial fibrillation. In the past, we've used radio frequency energy, which creates a small burn in the heart muscle, destroying the tissue. For atrial fibrillation, it's been shown that a lot of the sites of atrial fibrillation come from these structures called the pulmonary veins, which when the blood goes into the lungs and gets oxygen, returns back into the left atrium. In the past, we've done a pulmonary vein isolation using radio frequency energy, so we've burned point by point by point around the veins. Now we've got the cryoballoon, so instead of going up and very tediously going and ablating around the veins, we can go up with the balloon. We actually blow the balloon up inside the vessel, just right inside the heart, and it freezes in a circular fashion around the veins. Therefore, we're able to isolate the vein very quickly, and it's much more efficacious.
Why is cooling part of this process?
Right. We think cryoablation is a better way to go than radio frequency because it causes less tissue disruption. So we think, therefore, it causes less destruction on the surface of the heart muscle, and that's going to cause less complications down the road. We think it's also safer because it's less likely to destroy other tissues in the surrounding area.
This is a minimally invasive procedure. How well does it work?
So far, the preliminary studies suggest that it works as well as radio frequency energy, and if you look at the data and studies here in the United States that have high volumes, plus centers that are using it in Europe, the success rate is over 90% in certain patient populations.
Well, doctor, it's estimated that 3 million Americans have this disease. How many can be helped by the cryoballoon procedure?
I think a large percentage. In fact, most of our atrial fibrillation ablations that we're using, if not all of them, we're using cryoablation. It's important to know, though, that the cryoballoon is only indicated for people that have paroxysmal atrial fibrillation, which means that you only have it intermittently. It's not indicated for patients that are more persistent or in permanent atrial fibrillation. And those are people that have had it for a longer period of time and that are in it chronically.
Dr. Eric Johnson, thank you for joining us today on Smart Medicine.
Thanks, Joe.